Hey there, welcome to our channel. Today we're diving into a rare and fascinating condition called Stoneman syndrome. Imagine if your muscles and tissues started turning into bone. Sounds like something out of a sci-fi movie, right? Well, for some people this is their reality. Let's explore what Stoneman syndrome is, how it happens, and what can be done about it. Stick around because this is going to be an eye-opening journey into the world of rare genetic disorders. First, let's get the official name out of the way. Stoneman syndrome is actually called Fibrodysplasia Ossificans Progressiva, or FOP for short. It's an extremely rare genetic condition that affects about 1 in 2 million people worldwide. So, what exactly happens in FOP? Well, the body starts forming bone in places where it shouldn't. Muscles, tendons, and other soft tissues gradually turn into bone over time. This process is called heterotopic ossification. Now you might be wondering, how does this even happen? It all comes down to a tiny change in our genetic code. There's a gene called ACVR1 that helps control bone growth. In people with FOP, this gene has a mutation. This mutation makes the gene overactive, causing bone to form in the wrong places. Interestingly, this mutation usually happens spontaneously. This means it's not typically inherited from parents. That's why most people with FOP don't have a family history of the condition. Now let's talk about how doctors spot FOP early on. The earlier it's caught, the better doctors can manage it. One of the first signs is actually visible at birth. Babies with FOP often have malformed big toes. These toes are usually shorter than normal and turned inward. As children grow, they start experiencing episodes called flare-ups. These are periods when soft tissues become swollen and painful. Over time, these areas of swelling turn into bone. It's important to note that these flare-ups can be mistaken for other conditions. Some doctors might think they're dealing with tumors or other growth disorders. That's why genetic testing is so crucial for a proper diagnosis. A simple blood test can check for the ACVR1 gene mutation. This test is especially helpful for babies with toe abnormalities or people with unexplained bone growth. Doctors also use imaging tests to help diagnose FOP. X-rays, kinetic scans, and MRIs can show where extra bone is forming. These tests help doctors track the progress of the condition over time. Now I know what you're thinking, is there a cure for FOP? Unfortunately, at the moment there isn't. But hey, don't lose hope. There are ways to manage the condition and slow its progress. One of the most important things is to avoid physical trauma. Even minor injuries can trigger bone formation in FOP. This means being extra careful with everyday activities. It also means avoiding things like intramuscular injections and surgeries when possible. When flare-ups do happen, doctors often prescribe corticosteroids. These medications help reduce inflammation and ease pain. They can make flare-ups less severe and potentially slow down bone formation. Physical therapy can also be helpful for people with FOP, but it's not the intense kind of physical therapy you might be thinking of. For FOP patients, gentle, careful movements are key. The goal is to maintain mobility without causing injury. Many people with FOP use special devices to help them move around. These might include custom-made shoes, braces, or other mobility aids. These tools can make daily life easier and more comfortable. Now let's talk about some exciting developments in FOP research. Scientists are working on new treatments that target the faulty ACVR1 gene. These potential therapies aim to stop or slow down the abnormal bone growth. While they're still in clinical trials, they offer hope for more effective treatments in the future. It's also worth mentioning the importance of education in managing FOP. People with FOP and their families need to understand the condition inside and out. This knowledge helps them avoid triggers and manage symptoms more effectively. Let's hear from some experts in the field. Dr. Sarah Johnson, a geneticist who specializes in rare diseases, says,
"Early recognition of FOP's unique clinical signs, coupled with genetic confirmation, can significantly alter the disease trajectory by allowing for timely interventions aimed at minimizing trauma and flare-ups."
So recognizing FOP early can make a big difference. It allows us to start managing the condition before it progresses too far. Dr. Michael Lee, an orthopedic specialist, emphasizes teamwork in treating FOP.
Managing FOP requires a team approach involving geneticists, orthopedic surgeons, physical therapists, and other specialists. This collaborative care model ensures comprehensive management of the patient's needs and complications.
So we need different specialists working together to provide the best care. This includes geneticists, orthopedic surgeons, physical therapists, and others. Now you might be wondering, what's it like to live with FOP? Well, it's certainly challenging, but many people with FOP lead fulfilling lives. They adapt to their changing bodies and find ways to pursue their passions. Some become advocates, raising awareness about FOP and rare diseases in general. It's also important to remember that FOP affects each person differently. Some may experience rapid progression, while others may have a slower course. This unpredictability can be frustrating, but it also means there's always room for hope. And there you have it, a deep dive into Stoneman syndrome. We've covered what it is, how it happens, and how doctors are working to manage it. Remember, while FOP is incredibly rare, understanding it helps us appreciate the complexity of the human body. It also reminds us of the importance of genetic research in tackling rare diseases. If you found this video interesting, please give it a like and share it with others. Do you have any questions about FOP or other rare genetic conditions? Leave them in the comments below. Thanks for watching, and we'll see you in the next video.